Hello and welcome. My name is Dr. Abigail Seaver, and I am a naturopathic doctor. My specialty is helping people resolve their digestive problems and balance their hormones. And today we are going to be talking about digestion, in particular, irritable bowel syndrome. So, has food made you anxious in that you're not sure what foods are going to set off your digestion? And so you're almost becoming afraid of food for that reason, and you haven't been able to figure out what foods are best for you? Has your digestion started to interfere with your ability to work or play? And are you tired of being stuck at home because your digestion is so unpredictable? Well, you have come to the right place. This is exactly what we're going to be talking about today. And how nice would it be to be able to get ready for work in the morning and not have to worry about digestion problems such as diarrhea, terrible gas and bloating, constipation, abdominal pain interfering with your day? And how nice would it be to be able to know what foods you do well with and what foods you don't do well with so that your shopping, your grocery shopping, and your meal planning are made so much easier. So this is what we're going to talk about. I can relate to these problems that you're going through because I personally struggled with digestive problems since childhood. I had frequent stomach aches, really irregular bowel movements starting in early childhood. And that persisted over many, many years with some ups and downs. I learned some strategies when I was in naturopathic school to alleviate some of that. But it really seemed to come to a head about a year or two after I had my son, when on top of the digestive problems, I was feeling just incredibly fatigued. And every day I would come home from work saying to my husband, my brain just is not working. And I wasn't used to that. So I thought it could just be the sleep deprivation associated with being a young mother or a new mother, but I decided to run a food intolerance test on myself just to see what might come up. And lo and behold, several foods that I was eating frequently came up as severe reactions on that blood test. And so when I avoided those foods, almost immediately my digestion improved and my brain fog and fatigue improved. It was really quite dramatic and shocking. As a naturopathic doctor, I hadn't been able to figure this out on my own without running the test. And so that was incredibly beneficial. I then went on to balance yeast and bacterial imbalance in my intestines and got further improvement in my digestion. And so now at this point in time, I know what foods trigger me. I know what foods are good for me and I don't have a problem with, so that grocery shopping and meal planning are easier, and even eating out is easier. And I rarely have a problem. I rarely have a stomach ache unless I'm under a lot of stress or I know I've eaten way too much of the wrong foods. So this has made my life much, much better. Additionally, the brain fog and the fatigue really never came back once I resolved those issues. So that's been a huge blessing. I also wanted to tell you a little story about one of my patients, just to give you a little bit more example, or more of an example as to how this plays out or how I work with patients. So I wanted to tell you about Susan. Susan had been having increasing mid-abdominal pain, nausea, diarrhea, and really painful bloating and gas over several years. And she was getting to the point where she was just feeling grumpy, irritable. Her mood just wasn't right because she wasn't feeling well. And she wasn't able to do the activities like hiking that she really loved to do. And this was just not fun. She had seen her primary doctor several times for this problem because her primary doctor took her insurance. And she hadn't been able to get any resolution to her digestive problems. And her husband was really getting worried about her. So she came to see me, And immediately we ran a test for food intolerances for her. And in addition, I had her follow a low fermentable carbohydrate diet. And I had her start a couple of herbal formulas to treat bacterial, what I suspected was bacterial overgrowth in the small intestine. And then when I followed up with Susan 2 weeks later, she said, I'm feeling so much better already. The bloating, pain, and diarrhea are much, much less, and my energy is coming back. And then I just followed up with her again 4 months after we started our treatment, and those symptoms were completely gone. So, just my story and Susan's story will give you a little bit of an idea as to how this works. And there is a way to resolve these problems, and it is something that is achievable. Many patients come to me with irritable bowel syndrome thinking, oh, this has just been going on for so long. No one's really been able to help me with it. The symptoms keep coming back. I guess I'll just have to live with it. And I strongly believe that you don't have to live with it, that there are solutions to resolve this for good and strategies that I can help to teach you to get your digestion back on track if you've gone off track. So, in many cases, I see patients also who've been to their doctor and each time come away with a different pill. And those pills, oftentimes, the side effects are the same as the symptoms they're already experiencing. So they're experiencing side effects such as abdominal pain, constipation, diarrhea, and bloating. And so they're not really getting relief from these medications for IBS. And oftentimes, some of their symptoms are getting worse. So each time you come back from the doctor with a different pill, and it doesn't work or it makes you feel worse, you just start getting discouraged. I've also seen patients basically living on Imodium or other anti-diarrheal medications that are supposed to be used temporarily to stop diarrhea. But some of my patients or people who are coming to me with chronic diarrhea are basically living on Imodium. And so it slows the diarrhea or stops it. And then once they stop the Imodium, the diarrhea just comes back with a vengeance. So it's not really a great long-term solution. So I have been a naturopathic doctor for 15 years. And as a naturopathic doctor, I am trained to address the underlying causes of a particular condition so that you have the best chance of getting well. And so I have helped hundreds of patients with irritable bowel syndrome by really getting to the root of the problem. And in my experience, there are three major underlying causes for irritable bowel syndrome that may or may not be commonly recognized. So we're going to go through those one by one, and you'll get a better sense for how I approach my treatment of this condition. So number one, the most common underlying cause of irritable bowel syndrome is food intolerances. So as I mentioned with my own experience and with Susan's experience, that determining food intolerances can make a huge difference. And so what are food intolerances? Food intolerances are not food allergies. Food allergies in the classic sense are foods that would cause a fairly immediate reaction that might be hives or vomiting or even an anaphylactic reaction. Those are the types of allergies that you would go to an allergist to determine, and those would be immediate hypersensitivity reactions. Food intolerances are delayed hypersensitivity reactions. So that reaction is occurring anywhere from an hour to up to 2 days after you eat the food. So oftentimes you're not able to determine the food that's causing that delayed reaction because it takes so long to occur. And these foods are oftentimes foods that you're eating on a regular basis. They're incorporated into your diet almost daily. and they are causing a low-grade chronic inflammatory response. And so those foods are typically common foods. It could be dairy, it could be gluten-containing grains, it could be soy, it could be egg, it could be a number of common foods. But it's difficult to figure out which ones you're having a problem with unless you do specific types of testing for food intolerances or to do an elimination diet. And so those types of food intolerances are most likely to cause gas, bloating, constipation, and diarrhea. They can also cause other chronic symptoms such as fatigue, brain fog, chronic sinus congestion, headaches, and skin rashes. I've even seen them cause joint pain. So these are symptoms that overlap quite a bit with the symptoms of irritable bowel syndrome. So this is why I look into food intolerances, because I find that identifying those and eliminating them can make a big difference in your digestion. It may not be the only factor involved in your digestive problems, but it can be a big one. So I found that almost every single patient with irritable bowel syndrome has at least one or two major food intolerances that are causing significant discomfort, digestion problems, diarrhea, constipation, bloating, or gas. So why do we develop food intolerances? Food intolerances come from two places. One is heredity, so you can inherit a tendency towards this. And one really common example of a food intolerance that you inherit from your family is lactose intolerance. So lactose intolerance causes gas, bloating, and diarrhea upon ingestion of dairy products. The other way that you get or you develop food intolerances is via a phenomenon that we call leaky gut or gut permeability. And so leaky gut is a scenario where the lining of the intestine becomes more porous than it should be, allowing larger intact food proteins to leak through the lining of the intestine and to contact your immune system, where your immune system starts making antibodies against those foods, and that can create a food intolerance. So, why do we get leaky gut? Where does that come from? In most cases, leaky gut occurs because either you've had to take some antibiotics or steroid medications, you've had a pretty significant gut infection, like a food poisoning or a bad virus, stomach virus, or traveler's diarrhea, or there's been a major life stress or a major physical stress like a surgery or an injury. So those are the typical scenarios whereby you might start developing that leaky gut that would lead to the development of food intolerances. So let's go to the second most common underlying cause of irritable bowel syndrome. And this is an imbalance in the bacteria and yeast in your intestines. And why is this important for irritable bowel syndrome treatment? The reason it's important is that research has shown that one of the most common underlying causes of irritable bowel syndrome is an overgrowth of bacteria in the small intestine. So we often hear about bacteria and beneficial bacteria in the large intestine, which is where most of our bacteria should be, but the small intestine really should not have a high proportion of our bacteria. It should mostly be in the large intestine. And so when there is an overgrowth of normal bacteria in the small intestine, that can create a great deal of gas, bloating, constipation, diarrhea, and abdominal pain. And addressing that can be huge in terms of treating those symptoms. And so, how does that come about? Why would you end up with large amounts of bacteria in the small intestine? So it can occur due to an abdominal surgery. It can occur due to also a bad intestinal infection. It can occur due to having to take antibiotics or steroids. And then there are several other underlying medical conditions that can predispose to it as well, like diabetes. So this is a really common reason why you might have some of these irritable bowel symptoms. And so I will often use herbal formulas to decrease that population of bacteria in the small intestine. And then I might also incorporate a low fermentable carbohydrate diet for a period of time to prevent from feeding that bacteria in the small intestine. And the combination of those two things can result in amazing relief from those symptoms that we've been talking about. In addition to that, I will often look at what's going on the large intestine. So, as we know, there should be a lot of bacteria there and a big variety of bacteria. But when there is pathogenic or bad bacteria in the colon, which is the large intestine, or a yeast overgrowth or a parasite, even, that can also cause gas, bloating, constipation, diarrhea, and abdominal pain. So, in some cases, it's appropriate to do a specialized stool test to look for those types of infections and overgrowth so we can address what's going on in the large intestine as well and further improve your symptoms. So, let's move on to number 3. So, the number 3 most common underlying cause of irritable bowel syndrome is a problem with the gut-brain connection or the nervous system in the gut. So we now know that people that have irritable bowel syndrome, their gut-brain and autonomic nervous system connections aren't working properly. So the autonomic nervous system is the part of your nervous system that functions to automate things so that you don't have to think about it. And digestion, respiration, heart rate are included in that set of things that your autonomic nervous system is automatically doing for you. Normally, you wouldn't think about whether your digestion is doing its job, it just does its job. And so, with people with irritable bowel syndrome, that doesn't really work that well. So, there's a problem somewhere between the brain, the gut, and that autonomic nervous system, so that either digestion can slow, or it can be too fast, or there may be increased sensitivity to pain in the gut because of that misconnection. And then we also know in people with irritable bowel syndrome, there is a deficiency or a decrease in what are called serotonin transporters in the lining of the gut. And so that results in serotonin hanging around too long in the gut, which causes increased sensitivity to pain and diarrhea. So we can use herbs and amino acids to kind of manipulate that serotonin transporter to either enhance our motility to get your bowels moving faster or to slow it down if it's moving too fast. And also to address that sensitivity to pain, which can manifest as just having pain from eating a meal. So sometimes just the stretching of the intestines after eating a normal meal can cause pain. And that is, we think, due to that decrease in serotonin transporters in the lining of the gut, which can be treated, as I said, with targeted amino acids and herbs that are specific for reducing that pain sensitivity. In addition to that, there's been really encouraging and quite amazing research on a type of meditation called mindfulness meditation. So there was a study showing that people who had irritable bowel syndrome who received an 8-week training in mindfulness meditation had a 70% reduction in their irritable bowel syndrome symptoms. just by doing that meditation technique alone, which is quite remarkable. So I will often refer to local folks who train patients or clients in that technique, and that can be incredibly beneficial in reducing your gut and nervous system sensitivity to stress and anxiety and depression. So we're working at this through several angles, as you can see. And the combination of addressing all of these different angles is what makes this approach so effective. So, we've reviewed the top 3 causes of irritable bowel syndrome, and I wanted you to have this information so that we could move forward and start helping you identify your underlying causes for irritable bowel syndrome. And I wanted to do this because I don't want you to be one of those people that either just decided they're going to have to suffer with this forever, or you're going back to your doctor over and over, getting a different pill each time and not really having a lot of success with that, or even having side effects that are exacerbating your symptoms, or just living on Imodium or other digestive aids that aren't really getting to the underlying cause of the problem and really just acting as a band-aid. So I wanted to be able to help you uncover these underlying causes. And to be able to do that, what I decided to do for this webinar is to offer all of the attendees of this webinar a free 15-minute consult one-on-one on the phone with me so that you and I can talk about your specific symptoms and what's going on with you to determine if that's something that I could help you with. And then if so, then we would have you come in and I would draw your blood to test you for food intolerances, and we would get you started on a program to resolve your irritable bowel syndrome. After we test for food intolerances, we would follow up to review the results and come up with a customized program for what to eat. So you would know exactly what to eat and what not to eat. In addition, we would determine if we need to address bacteria or yeast imbalances in the intestines. And as I said, sometimes I will test for that with a specialized stool test. Sometimes not. Sometimes we can just go ahead with treatment even without further testing. So in that second visit, we would decide if we need to do that, and we would get started treating for bacteria and yeast imbalances. In that second visit, we would also start talking about what strategies to use to address your gut-brain connection and the nervous system sensitivity with this condition. And so talk about whether we want to use specific amino acids or herbs, or whether we want to incorporate some type of meditation to really tonify your nervous system and your gut and reduce sensitivity to anxiety and stress. And so the third visit would be a follow-up visit to determine how you're doing, assess whether our treatments are working, and to fine-tune as needed. So that's my plan for how to resolve your irritable bowel syndrome. And I would love to work with you. So please call my office at 970-626-3188 and schedule your free 15-minute consultation so that we can get started determining whether I can help you with the situation. And if you'd like further information about my practice and about me, you can go to my website, which is drabigailseaver.com. Thank you so much for attending. I really appreciate it, and I hope to be seeing you soon.